Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Kiko Auctioneers and Realtors, and of course our technical producer, John Pozica. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Nabeel Khan. Do I have that right, Doctor?
Yes, you do.
Okay. Plastic surgeon, plastic reconstructive surgeon from Aultman Medical Group. Good morning, Dr. Khan, and welcome to the show.
Good morning. Good morning. Thank you for having me.
Plastic surgery practice specializes in treatments for skin malignancies, breast cancer, and complex wound reconstruction, as well as non-surgical and surgical procedures. Today we're going to talk with Dr. Khan about the procedures offered at Aultman Medical Group, as well as new advancements in the techniques in the field. We'd like to remind our listeners today that you can get our podcast on the App Store of your favorite smartphone, so just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed.
So, Dr. Khan, tell us a little bit about yourself.
Yeah, I was raised in Northwest Ohio in the Toledo area, and I came to Northeast Ohio for most of my schooling. So I actually went to Kent State University for undergraduate studies. And then my medical school was completed in Rootstown, Ohio. At the time, it was called Northeast Ohio Universities, but now it's Northeast Ohio Medical School. I completed most of my training within the Metro Detroit area, including that of plastic and reconstructive surgery.
Were you at Henry Ford? Or?
Detroit Medical Center and Wayne State University downtown. So, was in practice for several years within southeastern Michigan, and had the opportunity to come back to northeastern Ohio a few years ago to the Canton area.
Okay, now you're in a group of several physicians, is that correct?
Correct. So I'm part of Aultman Medical Group, which comprises several different specialties, medical and surgical. And in our particular area is plastic and reconstructive surgery. In that division of the group, it's myself and my partner, Dr. Stephen Lopez.
Okay. So you practice in the hospital, is that correct? You have an office in the hospital?
We have an office off-site that we actually moved into a few months back at North Canton Medical Center.
Okay.
And we are on campus in one of their buildings and been settling in and enjoying our facilities there. We have a procedure area there where we're able to do in-office procedures, but our more involved surgeries are completed over at Aultman Main Hospital.
So that's exclusive. Do you go to other hospitals?
Not at this time. So we are right now exclusively at Aultman Hospital.
Okay. So tell us about some of the procedures that you may perform.
So they comprise what would be a part of the specialty of plastic and reconstructive surgery. So I was attracted to it originally because of the fact that there's so much variability within that field. Pretty much anywhere on the body, head to toe, any tissue system, skin, soft tissue, bone, muscle, and conditions related to cancer, related to infection, related to congenital issues, related to acute injury. It is a very wide specialty, and that's what keeps me interested every day.
What about non-invasive plastic surgery? Is that something you folks do?
Right, we do that, and that can be for a variety of things. Reconstructive type of procedures, potentially for skin malignancies, treating those with non-invasive techniques that don't involve traditional excision, to cosmetic procedures for facial rejuvenation, doing things like chemical peels or using lasers that don't involve traditional incisions, which we would think of as being more non-invasive.
Okay. So what are your thoughts on plastic surgeons versus non-plastic surgeons doing plastic surgery? A lot of plastic here. Plastic surgery procedures like Botox and fillers.
It's a very good question, and it is true that it is a very large field and comprises a lot of techniques. And in terms of cosmetic procedures, that is a part of plastic reconstructive surgery. But those are also procedures that other specialties are involved with, and other healthcare providers may be involved with. I take this stance that as we're doing these procedures, these are procedures, and we're trying to be as safe as we can. And part of due diligence is, if you're doing a procedure, being able to deal with any complications that may arise from those procedures. Being a board-certified plastic and reconstructive surgeon, I'm able to do that. I'm able to take care of any issues that may come up after doing a particular procedure. And that's sometimes lost, in terms of focus, that these cosmetic procedures are procedures, and we're trying to be as safe as we can with them. In terms of surgical procedures per se, cosmetic surgery, the American Society of Plastic Surgeons, which is the organization that represents greater than 94% of plastic surgeons within the United States, they have information about this, and basically their stance is, well, again, if we're trying to be safe about these procedures, we want to be able to take care of any issues that may arise. And if someone is interested in having these procedures and they're seeing someone in particular, that would be a fair question to ask: is that, should an emergency arise, or should there be an issue that arises after this procedure? What's the game plan? Am I going to see you to take care of this, or are you going to send me to the hospital to be taken care of, or to another practitioner? One example would be dermal fillers for injections to rejuvenate often the face. It's thought of as very benign.
What is a filler? What is the
So
product?
it's a compound, basically collagen, which is one of the building blocks of the skin, which often is now processed to the point where it can be injected to address areas, let's say, of the face that may have lost volume. So for volume restoration, we can say the cheeks as an example.
So what's the source of collagen? Where do we get it?
So it's compounded in a lab, hyaluronic acid, which is the most common type of filler. It's chemically processed and compounded to the point where we can actually have it as an injectable medication per se. And last year, almost 3 million of those type of procedures were performed nationally. And there have been a handful of complications, especially within the face. If that material is injected intraarterially or goes within the circulation, it can cause soft tissue damage and necrosis. It can actually lead to blindness. So that is something that I am always aware of when I am performing those type of injections in the office. And that's reflective of my training.
Because of too close around the eyes?
So the face is a very vascular structure, and the anatomy is very compact. So when you're trying to inject this material within the face, it behooves you to know the facial anatomy well, and to know where to inject and where not to inject, and know how to inject and how not to inject, to try to avoid passage of that material into the circulation of the face.
Now, there seems to be, in fact, I saw a commercial last night about hyaluronic acid in women's cosmetics and things like that. There seems to be a zillion products out there that are
Right.
advertising, promoting, whatever.
Right.
What's the deal?
So like any material or any medication, there can be ways to tinker with it, so to speak, in the lab. And we're always tinkering because we always are trying to make these type of injections safer and hopefully last longer. So now we're at a point where many of these injections last a year or two, which is nice to offer patients.
So in cosmetics, if they have hyaluronic acid in cosmetics, does it peel and tighten the area, or what is?
So as part of the normal aging process, we lose volume and tissue sags, essentially. And that's a combination of how the skin and soft tissue changes over time, and gravity. I sometimes jokingly say gravity is the plastic surgeon's best friend. So
I've heard that before.
Right. So, but in terms of trying to rejuvenate, and we use that term often, rejuvenate signs of facial aging, that's often how we do it, by restoring volume.
Okay. First break's here, Doctor. Thanks for listening to Health Matters, the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing plastic and reconstructive surgery with Dr. Khan from Aultman Medical Group. Have a question? Post it on our live Facebook feed. So I have one more, don't I, or not? Guess not. Go ahead.
Well, I was going to do a follow-up to your Botox and fillers, if you don't mind. You mentioned that occasionally there are some risks, and it's important for a skilled professional like you to be able to manage that situation. I mean, hopefully it doesn't happen, but everybody's a little different, and the techniques are probably a little more specialized than you learn in a weekend course, because that's what I've heard on how those work. So what about overall safety? So you mentioned hyaluronic acid is one of the primary fillers. Is that generally pretty well tolerated by people? Are there ever any allergic reactions, or what kind of?
Generally, it's very well tolerated. If there is a suspicion that there could be an issue, an allergic reaction, there are means of trying to test for that ahead of time, doing test doses. But that's always a part of the consultation, is trying to figure out, possibly if there's an issue with that.
Okay, very good. So, in our pharmacies, we're concerned about patients purchasing medications in foreign countries to save cost. And, our healthcare system is unique in that respect with what medications cost in the U.S. But what are your views on surgical tourism?
Personally, I wouldn't do it. I just don't think it's worth it, And, in terms of just the data, it's self-reported cases. When people go and have problems, that's when we tend to hear about it. So the actual number as far as how much is done, overseas is not quite known. But, the kind of issues that come out of that, can be very dramatic. Again, with the American Society of Plastic Surgeons, there's actually if you go to the website, plasticsurgery.org, there's a big column about this, and the data that is available is talked about pretty extensively. And one thing that, we have to keep in mind is safety again. So a lot of times these are packaged as a vacation, and the seriousness of these procedures is kind of downplayed. These are surgical procedures. These are procedures that can have complications. These are procedures that should be done with safety in mind, and sometimes it seems like that is lost. At least within the United States, there are regulations and standards and certifications that try to ensure that your surgery experience is as safe and as standardized as possible. That's not the case overseas. You don't know, exactly who the surgeon is or what their background is or what their training is. As far as the facility goes that is being done, you don't have guarantees about the sterility, about the equipment that's being used, about the staff that's there at the facility. The anesthesia that's being administered, if it's even appropriate drugs that's being administered for anesthesia. There have been reports in other countries where people would go for, let's say, a tummy tuck operation, and their anesthesia was to lay down on a table and actually have a block of ice placed on their abdomen before the procedure. That's it. So that's...
Did it work?
For a while, but there were obviously complications after that. So, and then the patient would come back if they were able to survive to the United States and be taken care of there. And obviously, that's not how it should be done. So that is the concern. Is again safety. So the other thing is to take into mind that these experiences are packaged as vacation experiences. So there's activities that they try to say, oh, you have your surgery, then we'll go ziplining, or you have your surgery, we'll go parasailing. Your body has to have time to recover, and those type of activities are not compatible with having a major operation. And the other thing is the travel. You're traveling often by air for several hours, and at least through the American Society of Plastic Surgeons, if you're having let's say a tummy tuck or a liposuction procedure, they're recommending to avoid air travel for a week or so at least. if not longer, for other procedures. And hopping on a plane right after that surgery like that, we worry about blood clots, we worry about cardiopulmonary issues in travel, and you have a medical emergency on an airplane. That's not the place to have it. So,
jeez, it escapes me what in breast augmentation, the product they were using and supposedly it got into the vessels and it was toxic. I don't remember the name of it. But then they went to saline, right? And now they're back, aren't they, to that?
Well, you touched on a couple of good points there. To finish up the previous question about medical tourism, the other thing is we don't have guarantees about, let's say you're having breast augmentation surgery, that implant, is that truly a recognized, a company, a standardized implant versus something else, In terms of breast implants in general, yes, that's one of the most common, implanted devices for a plastic surgeon. Breast augmentation surgery is one of the more common cosmetic procedures that's done. But, it's also used for breast reconstruction. A great part of my practice is that, and I use that very often. And in a nutshell, this technology, breast implants, has been around since the 1960s and well studied, for decades, again and again and again. And the choices that we have for these implants now, they have silicone shells, and they're filled with either silicone or saline. Recently has been brought into focus again because of two entities. One is breast implant-associated illness, which is a constellation of symptoms that patients who have had breast implants placed, may identify. Fatigue, chronic pain, other ill-defined symptoms, which now there's concern is that related to having breast implants placed. And the answer is we don't know. We've studied that quite extensively, and we still don't have a direct link between having breast implants and this entity that's called breast implant-associated illness.
So is it common, or is it long-term or short-term? Or?
We don't know. I mean, we don't have a test for it. We don't have a defined, accepted, standardized criteria to diagnose it. So we just can't define it yet. But thankfully, we're having, through our societies, more intense research efforts into it. It's frustrating to not have all the answers, but that's part of process of medicine and process of science that hopefully over time we do have answers. But this has been studied, again, since the 1960s when breast implants were first developed. In the 1990s, there was a more intense focus. There was actually a moratorium on use of silicone breast implants where they were actually taken off the market for about 10 years to be studied. There was issues with that study in terms of the scientific method, but they were brought back, approved by the FDA in the early 2000s because there was not a direct link found between having these implants and issues with these implants.
So is that the common product used today?
So the common product, it's hard to define that too, but in terms of what is used in terms of implants, it comes down to silicone or saline. I would say that if we divide it further into breast augmentation, probably the more common product is silicone-filled breast implants. For breast reconstruction, it's more of a mix between silicone and saline.
More natural than the saline, yes, no? Or?
So another interesting question, the silicone, again, is it's a naturally occurring element. It's crystalline silica sand. The medical grade silicone is a processed version of that silicone. So it's not just standard run-of-the-mill sand or what's found in commercial industry. But it's still a variant of a naturally occurring element. The saline that's in some of these implants that are used, that's physiologically compatible with the saline that's in our bodies. We're mostly comprised of water, so physiologically that's more in tune with that. But in terms of what's more natural, I get into this with patients when I talk about options, in terms of whether they're looking for what are our goals, and that's part of our consultations, what are our goals for surgery. If a woman says to me, who's had, breast cancer and wants breast cancer reconstruction, and we talk about this as being an option using implants in some shape or form, if she says to me, I want to have something that looks and feels as natural as possible. When I go to give someone a hug, I want them to not be aware of something. And that's a very common question I'm asked. And I say to them, based on experiences from patients that reported back to me, that they often say that the silicone-filled implants seem to look and feel more natural to those patients. It's never going to be 100% as what a breast was, that had to be removed for cancer, but we try to be as close as we can. Again, all these implants fall under the direction of the FDA, the Food and Drug Administration, and there are criteria for use of these implants. And use of silicone breast implants in particular, we screen for them pretty diligently after use. We want to look for problems with implant rupture. With a saline implant, if that deflates, we use that term, the salt water is reabsorbed by the body. With a silicone breast implant rupture, if it ruptures, then we're worried about escape of that silicone out of the implant. And we are worried about harm from that free-floating silicone. We don't have all the information yet, but we have come to the conclusion that that's not a situation we want to be in.
So you have to go in and remove them then?
If there's a concern for a ruptured silicone breast implant, the recommendation is to remove it.
Okay. How often, after the surgery, how often do you have to see the patient? Is it annually or?
So the recommendation for screening after, let's say, use of a silicone breast implant, and let's say it's for breast cancer, at least for right now, the FDA, the Food and Drug Administration, is recommending having at least an ultrasound done to check those implants 3 years after they were placed and every 2 years, ongoing. Oftentimes, I'm seeing patients back on a yearly basis, not only to see how they're doing after breast cancer reconstruction, but also as a part of general health screening, because we worry about breast cancer recurrence.
Sure.
And in the setting of breast cancer reconstruction, checking for what we call chest wall recurrence sometimes can be a little bit confusing if you were not the surgeon that performed or the doctor or the physician or the provider that performed the reconstruction. So that's why for those patients, I'm often seeing them back more often than other patients.
Okay. Bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing plastic and reconstructive surgery. We've got a lot more to cover this morning, so let's get back to the show. I don't even know where we're at.
Well, how about we've talked quite a bit about breast implants. What about men? Do men get cosmetic surgery?
They do, yeah. And I think part of that is also now with social media. So, and men and women are more involved, and with the advent of social media and the technologies associated with that, people are more aware of appearance, and it's become more socially acceptable for men to pursue, cosmetic procedures. In fact, a funny play on word, Botox for men. A lot of places call that Brotox for men. So that's a common procedure for men, as well as surgeries for body contouring for men now. Liposuction, or something called high definition liposuction. We're doing etching work to try to really define those six packs that some men may want to show, or of their chest, in terms of their pec muscles.
So you can make artificial pec muscles?
You can use implants. You can use implants to actually augment, the appearance of your chest. But in terms of, let's say, liposuction, trying to correct for some men a condition called gynecomastia, which is hypertrophy of breast tissue in men. And that is one of
is it common?
So it is more unfocused now than it may have been in the past. Men especially are more aware that this is a condition and that can be treated, and often is treated by a plastic surgeon. And there are different ways to treat it, but one of which is liposuction. So that's just again, in the era that we are, it is more acceptable now for men to seek treatments for conditions like that.
Amazing. Wow. But we've danced around this a little bit. What about insurance for most of these?
Right. So that's the example of gynecomastia. So hypertrophy of breast tissue in men, abnormal hypertrophy in breast tissue in men. So there are potentially several different causes for that. Sometimes we never know. So sometimes we call it idiopathic. But other times we may say it's related to hormones or related to medications or related to other medical conditions. If we can talk with the insurance company about that and hypothesize what we think the cause is for that, and show, the condition of the patient or describe to the insurance carrier the condition of the patient, many times it can be covered, by an insurance company. Sometimes it's not. It is unfortunately a situation where many carriers have it defined. If it's not this, we don't cover it, and it's a very frustrating experience for patients and for us as well. Trying to provide those procedures for patients. But that's one of those procedures that it's a condition. It's a medical condition. There are medical causes for it. For me, that would be more of a reconstructive type of procedure to address it, versus other conditions. If we're doing liposuction to remove excess fat, to contour the body, to fit into clothing better, it's a harder argument to make to an insurance company about that.
Sure.
But in terms of this, as well as other conditions, and say women, who have excess breast tissue, what we call macromastia, and they're having neck pain, back pain, shoulder pain, problems with the skin, sometimes even irreversible changes to their spine from these large-breasted women, for these large-breasted women.
Well, that generally qualifies then, doesn't it, under insurance?
It usually does, but again, there are some insurance companies that it's not a covered benefit, was the terminology they like to use. So,
well, the thing about health insurance, it's so doggone expensive, and you would think that some of this stuff would come along, but it's going, some
right.
of things are going away as opposed to.
Yeah, and it seems to be ever changing.
It certainly is. What about children?
So as part of our practice and my practice, I have treated children, and I have taken care of oftentimes skin lesions that may arise of concern, in children, concerning to parents, concerning to pediatricians, other providers. There is a condition, there's entity of skin cancer that's described in children, unfortunately, and we want to be sure that we can treat that, effectively and promptly. In terms of specifically how these are treated, oftentimes it's by removal, by excision. And if I'm able to offer that in the office, for children, I can. Older children tend to be more compatible with or able to tolerate having such a procedure in local anesthesia in the office. Younger children, depending upon the age, depending on the location of the lesion that we're trying to treat, probably be better served in a hospital setting.
What about a keratosis? Okay.
Mm-hmm.
Got one. Okay. And the surgeon looks at it and he says, "Well, I got to take off half your back if I cut that away, even though it's not cancerous." And I don't really understand the procedure. You take a little tissue off, send it away for analysis.
Yeah.
Come back, maybe have to do more surgery. I don't know. So
keratosis, loosely is, hypertrophy of keratin layer of the skin. Actinic keratosis is damaged hypertrophied keratin-containing skin that is recognized as being a pre-malignant condition that can later progress onto basal cell, or more commonly squamous cell skin cancer. Seborrheic keratosis,
Dang, I didn't know there were all these.
Right. Seborrheic keratosis is really more related to aging, and what
that's why I got it.
Yeah, some may get. And textbooks in the past were not very flattering about that. They would actually call it the barnacle of old age. So they don't use that term anymore. But it can be still something that can be uncomfortable for some patients. Can be not visually pleasing for some patients, and that some patients may want to have treated, and often treatment is removal. In my practice, whenever I'm removing something, if I have any concern about being cancer, I send it to the lab. I send it to a pathologist to be tested.
Okay, interesting. What about new techniques and newer equipment, or
Yeah.
I know the laser's big time.
Yeah.
Just about everything anymore. But.
So newer techniques, newer technologies. That's also part of plastic and reconstructive surgery, and there are techniques and technologies that we're able to offer. That have not traditionally been available within the Canton community. I'm in practice with, again, Dr. Stephen Lopez, and he is able to offer microsurgery, free tissue transfer, so taking tissue from another part of the body and reconnecting it under a microscope with blood vessels there to address traumatic injury, to address breast cancer reconstruction. And it is quite a remarkable feat, and that's something that is available now, for the community. You touched upon lasers, and yes, that technology is always evolving, and the applications for such are always evolving. Not only cosmetic for facial rejuvenation, so to speak, but also for reconstructive treatment of skin cancers, treatment of other medical conditions. We do fat grafting now, which is actually taking fat processed from another part of the body and re-injecting it to address many different conditions. For me, I use it in breast reconstruction to help. And in the office, as a means of being more safe, using special cannulas for injections of the dermal fillers that we talked about in the past to reduce the risks of problems associated with those fillers. So it's an exciting time because things are emerging and evolving. And the future, I believe, will be tissue replacements grown within a lab, artificial skin. Hopefully, one day it's in a spray can form. So just if there's an issue, just spray it on. And there's been heavy funding, from the military to look into that, as well as replacement of parts of the body that had to be removed from one condition or another. Amputees, helping them out. Cancer patients who've had extensive surgery to remove parts of their body. So it's exciting.
Working with the wrinkles and things around the eyes, do you work with an ophthalmologist in that sort of process or not?
So as a part of our core specialties or core training focuses, one of which is around the eye. So as far as the eyelids, the forehead, the cheeks, the rest of the face. So addressing medical and cosmetic conditions is often what we do. In certain situations, let's say trauma, if I'm concerned about a patient that may have been asked to see for, let's say, a fracture of the orbital floor or the floor of the eye socket, a very common area that's injured in accidents and where there's blunt trauma to the face. But if I have any concerns about the eye and the eyeball and the retina, working commonly with the ophthalmologist to address those injuries as well.
Wow. Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We are back. You're listening to Health Matters with the Medicine Center Pharmacy, our final segment of the show.
All right, I have to ask, because this sounds a little scary, because all I can think of is Luther Crank from Christmas with the Cranks, where he's poking his forehead with the fork on his recently Botoxed forehead. So if you've ever seen that image, it's kind of funny. But anyway, so I hear there's such a thing as Botox parties, and that sounds a little scary. So how about you speak to that and maybe help our listeners understand if they feel like, well, I don't want to steal your thunder, but I can already guess what you're going to say. So
Well, it's I think a more common entity now in the age of social media, and also in the age of having cosmetic procedures, being more socially acceptable, and something that has become more of a social experience, and now as a social group experience in some situations. And for me, again, like any procedure, it's still a procedure, and trying to maintain clinical focus on that procedure and safety for that procedure. My only concern is sometimes the marketing for some of these, events maybe downplays that it's still a procedure that has risks that, should be, put into focus, and safety should be always of utmost concern. And not to say that those that are participating in those events don't have that in mind, but some of the marketing for some of these procedures, to me, may be a little off-putting.
I guess my analogy is we have a non-sterile compounding laboratory in our pharmacy in New Philadelphia, and we make capsules and tablets and suppositories, creams, ointments, gels. We have very strict guidelines from USP, from the Board of Pharmacy. I mean, we have to do a lot of things where I almost feel like now the quality of our environment to make a non-sterile product is what probably a sterile environment would have been 5 years ago. So when you're talking about injecting things, because you pretty much always inject Botox, correct?
Right.
So I'm just thinking, I just can't imagine it being done by anyone but a healthcare professional like yourself. It seems to me that you're dealing with an item that's a sterile procedure, and if you don't have the ideal environment, you have risk of infection and contamination,
right.
And that's bizarre to me.
So yeah, one is always sterility. That's a concern, and obviously, healthcare providers, with the training, we have that as our focus. And you're right. There is a situation where some of these events are being put by or performed by people who are not necessarily healthcare professionals. And Botox does have a risk. Vessel injury from Botox, an injection that touches back with the vascularity of the face, and then having to know the facial anatomy. But also, it is botulism toxin. It is a toxin used to intentionally paralyze muscles of the face, and especially around the eyes, that can cause problems if not done correctly, in terms of paralyzing muscles to the eyes, lids themselves, and causing visual disturbances. Or if you're doing Botox around the mouth and having issues with the functioning of the mouth, So that's just part of, again, safety. Another part of these events, sometimes it's not just Botox. It's, again, the dermal fillers that we talked about before, and the potential problems with that especially, that we've touched on before.
So the dermal fillers, what would we do with those in the face? I mean, what are the most common? Hey, I want you to fix this.
So, in terms of facial aging, that I am consulted with or by patients pretty frequently. One, again, is with time. We lose volume in the face, and we have what's called descent of structures of the face. Often the mid face, the cheeks, they start to go south. So that for some is of concern, and they come in to see us to talk about what we can do. And as far as restoring volume, that's one of the primary uses for a filler, and restoring volume within the midface, within the cheeks, to try to counteract that descent.
Well, wouldn't that push up against the teeth, or is that not?
So that goes back to anatomy. So if you know the proper place and space to inject those fillers, so we are lifting the tissues from south back to north, along the cheeks.
So that's not an issue, really.
Right.
Is it? Okay.
Right. So if you're not doing it correctly, then yes,
Yeah,
you would have more concern about worsening that.
I guess we're getting a little tight on time. What about a general appointment with a patient? Do you advise the patient not to have a treatment, or as well as have one?
So whenever I'm seeing anyone, be it for reconstructive or cosmetic, I'm partnering with the patient to try to figure out a couple of things. One is, what are the goals of what we're trying to do or trying to accomplish? And for, let's say, breast cancer reconstruction is pretty straightforward, trying to rebuild the breast as best as possible after removal for cancer. For cosmetic surgery, breast augmentation, trying to enlarge the breast for women as their goal, for that cosmetic procedure. Now, if I don't have a defined goal that I can identify with the patient, then things get a little bit blurry. If what we're talking about medically doesn't seem to be something that I feel the patient could tolerate for a variety of conditions, cardiac history, pulmonary history, underlying conditions, underlying medications that they have to have that may be reacting in not a positive way with anesthesia, then that's another area where things get blurry. So if I can't define a goal with the patient that I find reasonable, or if I can't define a safe way of accomplishing something surgically with the patient, then I personally would advise that in my practice, this is probably not a good idea. And try to come up with alternatives for that patient, in terms of treatments that they're trying to seek.
What about body dysmorphia?
Yeah. So that is something, it's a described condition where patients, those that have this condition, are not satisfied with their physical appearance, and unfortunately may never be satisfied with their physical appearance. When they're looking at themselves, they always see something that is not to their liking. And what they see, it may be difficult to define together when I'm seeing the patient. And if I have any concern about that, I talk about with the patient, and I say, if I'm concerned about this is the condition I'm concerned about, and would try to make the appropriate referrals for that patient to seek guidance and treatment for that. My worry is that if we pursue, let's say, cosmetic surgery for a patient like that, we are exposing them to risks of surgery, risks of anesthesia for a procedure that they may never be satisfied with.
Sure. Interesting. Okay. I come to you. I saw this on the internet. Here, I want you to do this, doctor. One of my physicians said, well, most people come in here and tell me what to do since they've seen it on the internet and they've seen all these treatments. What's the deal?
So again, that goes back to the consultation and the importance of the consultation and trying to partner with the patient, again, to try to identify, what is the condition, trying to identify what is the goal for treatment and the treatment options. And if we can come together on the same page with a safe plan, then I would be happy to address that with the patient and take care of that patient. If I can't, for whatever reason, then I point out why I can't, and are there factors that I can help them with, or factors that other physicians or providers can help them with to correct or help, let's say, a medical condition prior to having a surgical procedure with me, and then we partner in that aspect.
Okay, doctor, we're down to about a minute or so. Any final comments, and can you tell us your phone number and how they can reach you?
So it's an exciting time again for plastic and reconstructive surgery. The technologies that we employ are always changing, and again, we have many technologies that were not available within the Canton community in the past. I am a part of Aultman Medical Group, as well as my partner, Dr. Stephen Lopez. So you can visit our website, www.aultmanmedicalgroup.com, as well as see the other specialties that are within that group. If you call our office at area code 330-499-2209, you will talk to our great office staff, Jean, Randy, Michelle, Debbie. They're wonderful and great partners in care.
Okay. Some surgery procedures done in the office,
So in terms of procedures in the office, medical and cosmetic procedures we're able to offer in the office. And we can talk about what we can and can't offer in the office during consultation.
Okay, super. Thanks for coming by, Doctor. We really enjoyed it.
No, thank you for having me. Thank you.
Very
Thank you.
interesting
Thank you.
program. Thank you to Dr. Nabeel Khan. Did I get it right? I'm good
Yes,
with names,
yes.
but not good with names. Okay. Plastic and reconstructive surgeon with Aultman Medical Group. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Kiko Auctioneers and Realtors, and, of course, John Bozica, who's acting as our technical producer today. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here on next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.